Hi, everyone. This is Joni McGarry. Thank you so much for tuning in. Today, I'm speaking with Dr. Carla Peeters. She's a strategist and interim CEO in healthcare for a healthier world. She has a PhD in immunology. Dr. Peters is particularly interested in guiding people with disabilities back to full health and productivity via personalized nutrition and lifestyle improvement plans. Dr. Peters has written extensively for Brownstone Institute, which is where I became familiar with her work. I invited her to talk to me today about her most recent article on the hidden and alarming post pandemic decline of female health. She talks about the possible causes of this decline and what the risks are for our society and economy and for future generations. She argues why we need an effective global and local public health policy for better female health and why we need one urgently. I found this discussion quite fascinating, and it opened my eyes to many things I had never really thought about when it comes to female health. I hope you will find it as compelling as I did. Welcome to the show, Dr. Peters. I'm so honored and glad to have you here today. Thank you for joining me.
Thank you. Thank you, Joni, for inviting me. I'm very excited to have an interview in US because normally I give interviews in the Netherlands, Dutch. So this is new for me. So I'm very excited to give my presentation. Thank you.
Oh, you're very welcome. And just for listeners, Dr. Peters is coming to us from the Netherlands. I'd say this morning, but it's afternoon there now. And I became aware of you through your work at the Brownstone Institute, where you've published a number of articles, and most recently focusing on the decline, the alarming decline in female health that seems to be not being talked about, and particularly post-pandemic. So I wanted to talk about that today. But first, why don't you tell us a little bit about yourself, what you'd like our listeners to know, and then we can jump into what you're seeing that's very alarming globally about the female health decline.
Okay, thank you. So I'm Carla Peeters from the Netherlands. I've studied molecular science and natural science, and after that I did my PhD in immunology. I worked for 10 years on vaccines, and that is very relevant because of the pandemic and the vaccines. And after that, I changed to change management, interim management, and I became a CEO of healthcare organizations. And during that time, which was a very stressful period in my life, I also was misdiagnosed 5 times by medical doctors. So that is the reason that after that time, I started my own company, which is Kobala, which is about 10 years back, which is about personalized integrative care and is focusing on the immune system. And what I see is that most chronic diseases can be reversed. So that is with personalized integrative care. And what I mean with personalized integrative care is mixing traditional medicine like Ayurveda with common modern medicine. So I'm not a doctor, but I use quite a lot of vitamins, minerals, and herbs, and also yoga, meditation.
And so in your from what I've read about you, your impulse is to not cure this or not to suppress the symptoms, but rather get to the root cause so that people can feel better, function in society, and become productive members again to the whole of society.
Yes, and I also guide them in discussions with medical doctors so they can be involved in shared decision making instead of being pushed into a certain medicine or treatment.
Which is, I think, often the dynamic when one goes to a Western medical doctor. They just take the advice and there's not really collaborative conversation.
Yes.
So you've discovered recently, or I don't know when you started seeing this, your articles collate a lot of data from around the world of what people are seeing in women, especially versus men post-pandemic. Can you tell us a little bit about what you're seeing about the decline of female health?
Yes, I noticed that already 10 years back that more women are out of the workplace than men at a certain age. But during the pandemic, I wrote my first article in 2023 especially about women
Hmm.
and the collapse of women health and work. It is also on Brownstone. It has 100 references, so all
Hmm.
the numbers I don't know by heart.
Sure.
But I started to study why are females getting out of the workforce, and it's not. I think it's because the immune system is declining, and there's much more stress on the females in pandemics and crisis than on men.
And
You can
tell me
say
why
why
that is. Yeah, why
at
is
least.
that? Yeah.
Sorry.
No, you were just going to say it. Why would that be the case? Why would there be a difference
Yes,
during a
there's a
crisis
difference
in a
because
pandemic?
they in the back they do quite a lot of unpaid work,
Hmm.
which is taking care of elderly people, parents, but also for the children. And with the lockdowns, this was the case. And also, many women work in healthcare. So
Hmm.
in the healthcare system or a caring system, child care and that kind of thing, social care. Mostly it are the lowest paid jobs.
Hmm.
So it are also not the persons who are very healthy in origin. So what you have seen, and they have also been working during all these stressful periods of lockdowns and masks and um, frequent testing. So they have been exposed to many toxins.
Hmm.
So that is for me and much stress. So they had to do their job. And besides that, they had also to do schooling for the children, education at home.
Hmm.
They had to take care of their parents who are ill or whatever, or their partner was ill. And that is what's happened. So
Hmm.
they have had a much more stressful period. But there's much more because I also wrote about a decline of the lack of young female health in the Netherlands, but it's everywhere. It's also in UK. It's also in US. They are exposed to much more medicine than men.
And what kinds of
And
medicine are they exposed to that is gendered?
antidepressive medicine, but also anticonceptive medicine.
Hmm.
They use quite a lot of Tylenol, acetaminophen, which is called paracetamol,
Hmm.
because of pain with menstruation or
Hmm.
headaches. Um, so they are exposed, and also the beauty myth: you have to be beautiful, you have to be thin, um, you have to be happy always. Not possible to be depressive because otherwise you are a depressive woman.
Right. And you can't
And
age. You cannot
yeah,
age. So perhaps you should inject your face with fillers and Botox.
Botox,
Yeah.
and they are really dangerous. So they
Um,
are damaging the immune system. And the immune system is everywhere. So it's in the ovary, it's in breasts, it's in the lungs, it's everywhere. And that is the mix which you now see to expose in women. And also women who work in healthcare have been exposed to much more toxins and
mhm.
much more stress. They are also vaccinated quite a lot more. So they have been repeatedly vaccinated with the COVID vaccine, but also with the flu vaccine, also with hepatitis B. So you can just continue like that.
Right. And so it's just really, if you look at the gender percentages in healthcare, women just have a much higher percent. And not to say that there are not male nurses, but most of the caretaking jobs are women, as you said. And so and also going into childbearing years, many are on contraceptives. I think your point about the pain relief for menstruation is, I've never even thought about that as being a thing, but of course it is a thing. And just the multiple vaccinations they've had and the exposure to different toxins, the swabs up the nose on a weekly basis, the
Yes.
masking with all those breathing in of whatever is in the masks. And it's something I think you are the first person I have heard talk about this in any detail, even though the research that you talk about in your papers seems to be fairly well documented. And in the beginning of the pandemic, I know that Naomi Wolf was sounding the alarm about the disruption in menstrual cycles from the vaccination,
Yeah.
signaling that women perhaps may have different side effects from these interventions than men. So you're putting this all together. What are you? I guess the question is, so this is happening. What is being done to address it, and or to find like the root causes? You talked about um, long COVID maybe as being also a thing, but is there also long backs? I mean, it seems like a lot to tease out, and so I'll let you start with where you think the most important part is, and how we should be looking at this, and how we should be raising awareness about this. That was a big rambling long question. Sorry.
Yeah. And so thank you for this question, which would be a long answer, but I will try to summarize it. I think we have long COVID, which is increasing. We have autoimmune diseases, which are increasing, and we have vaccine injury syndromes increasing, and cancer, not to forget.
Mhm.
And what we see is that now it's mostly women getting this. Autoimmune diseases is known; it's about 80% female. Um, Long COVID is 73% female. Um, Cancer is declining for men, but fast increasing for women.
And is
So I've looked at American Cancer Society data, and you see already before the pandemic that male is declining and female is going up. So they are crossing each other, and this is very special. It's strange, but it means that the immune system of women is declining whether there when there are also publications from earlier years that especially women survive better during pandemics and crisis and famine. So that's hunger.
Mhm.
And I didn't talk about this yet, but also I don't know. I think it's also in US the same, and in UK. And there is much politics on getting people on vegan food.
Yes, there is a real push
And most
toward
of the
that.
women are very sensitive, especially the young women. I just, before a presentation in the Netherlands for a conference on childbirth, I doc, I, um, I searched for the numbers, and I found that about 30% is going vegetarian and 8% or something vegan. But
Of
vegan is
women.
very dangerous, especially if you want to be pregnant and if you don't know what to do with vitamins and minerals and so
Mhm.
on. And all this together is minimizing or declining the immune system. And the stress is only becoming bigger. And if they then also use vapes or Botox or alcohol together,
Mhm.
it's getting more and more. And if you are stressed, you are easily taking more Botox or drugs, or because you want to join the party.
Mhm.
So, and this is another example. People are much more taking methylphenidate, ADHD, for people who are overstressed, which is a common disease now under the younger people. It's
Can
like a bit like autism, but it isn't autism. Um,
can we let me stop you for a second? I didn't quite get that.
it's
For AD, oh,
ADHD.
amphetamines for
Yeah,
ADHD. I see, okay.
methylphenidate, Ritalin, or Concerta.
Yes,
It's
which are
called, and
stimulants.
many young people are prescribed it, or they
Mhm.
use it during study because they can't concentrate. And if they use this drug, which is not prescribed by a medical doctor, they get addicted to it and continue to use it. But there are many side effects to these drugs.
Mhm.
So all this combined is affecting the immune system, and at certain point, this immune system is going to collapse. So if I go through that and to long COVID and post-vaccine syndrome, which has many the same symptoms as long COVID, um, the most people are overtired, tiredness. That is the first thing. They can't concentrate, so fatigue they call it. They have pain in the muscles. They can't be somewhere in a noisy room. These are all the same symptoms. And if you go back, it has always to do with the immune system, which is in the guts, which has 80% of the immune system. We always thought when I worked on vaccines, we didn't know there were bacteria in our gut. And these were the bacteria I was working on. And it's are called opportunistic pathogenic bacteria.
Mm-hmm.
And this is pneumococci, streptococci, it's Haemophilus meningococci. And if you get your immune system is going to collapse, these bacteria are increasing and they excrete toxins.
Mm-hmm.
And this is dangerous. And it can come to any disease. It can be acute respiratory distress syndrome. It can be a collapse of the liver. It can be kidney injury or acute kidney injury.
Mm-hmm.
So it's a combination of things. And if I go further on this, is that I've written a paper on that also before the latest paper, which
Mm-hmm.
is on the increase of female healthcare suicide. And the healthcare workers, they want to work for the patients. Many are very intrinsically motivated to work for the
Mm-hmm.
patients to
Mm-hmm.
give care.
Mm-hmm.
I think it's something typically for women wanting to give care to someone else, and it's satisfying.
Mm-hmm.
So they continue, and because the illness, the number of people having disease in healthcare sector, it means that the people who are still working have to work harder,
Mm-hmm.
more hours and more stressful, and they can't give the care they want. So mentally, they get deprived as well because
Mm-hmm.
they can't do the work as they used to be.
Mm-hmm.
So what they are doing is then taking medicine. So they take medicine, and sometimes they are not prescribed. And I talked already about Tylenol, acetaminophen,
Tylenol. Mm-hmm.
paracetamol,
Mm-hmm.
and it's easily taken next to other medicine, which are sometimes very heavy medicine.
Mm-hmm.
And what we know is that this can cause acute liver injury. So
Mm-hmm.
I'm discussing in this paper, is it suicide or is it non-intentional fatal overdose?
Mm-hmm.
And this is maybe not only happening in the healthcare sector, but also outside
Mm-hmm.
with patients. They get prescribed quite some medicine and they add paracetamol or Tylenol or acetaminophen
Mm-hmm.
for getting rid of the pain.
Mm-hmm.
But the root cause, which is, in my view, has to do with nutrition, is not taken up. So
Mm-hmm.
medical doctors are not looking at that part. They only have the medicine
Mm-hmm.
to serve the people,
Mm-hmm.
and that is what they do. So, and because that is how the healthcare sector is working, the healthcare workers are also only aware of taking the medicine and not how can I improve my nutrition.
Right. And also, they're increasingly in systems that don't allow healthcare practitioners to put the patient first. There's a top down, in the US anyway, and perhaps it's this way in Europe as well. But hospital care has become very corporatized, and the hospitals have purchased up private medical practices and installed standards of care and protocols for everybody who works for the hospital at the hospital. And so rather than looking at each patient to find out what they need, they have to check off the boxes of the protocol. So you were seeing a decline in female health pre-pandemic for all of the factors that you noted, which I think a lot of times go unobserved for women. For many society reasons, and also just I don't think people, and this is a statement that could get me in trouble, but I don't think women's work is always valued as
You're right.
being real jobs. And I'm somebody who was in the workforce with a career when I was single and didn't have children, and then gave that up entirely to stay home raising a child. And I realized when I started to do that that was real work, that it wasn't something to roll your eyes at, which I used to do. I think, what do these women have to talk about? What do they do all day? And also just caretaking. So you have all these factors going into the pre-pandemic, and then the pandemic puts even more stress for all the reasons you talked about, including women losing their jobs because
Yes.
schools were shut. They had to homeschool their kids, and if they had an outside job paying for it, they would lose their job. So there's the stress of reduced income. Um, it's such a big thing to tease out, how to shift it or how to determine what the best course of action is for unwinding this and starting to make changes in improving women's health, which one thing that is necessary to do this for is simply fertility. In one of your articles, you talk about the declining health of um, women pre-pregnancy,
Yes.
and so it's not older women; it's younger women who
Yes.
are feeling this impact greatly. Tell me how you're seeing it impact fertility, pregnancy, and postpartum. All of these stressors.
Mm. I think that during the pandemic, it has become worse. So if I'm very straight about what I think, um, if young women want to become pregnant, but many don't think about it because they only think about it when they near the mean age is now 28 or 30
Hmm.
in Europe. So before that time, they don't think about it, most of them. So they don't think about of getting a healthy body.
Hmm.
So nutrition is never an issue. Although they follow influencers, many don't know how to exactly what they need for their body. So it's all by influences of others. They start to take care of the body, but that can also be the wrong things. And if they have been using Botox and fillers and anticonceptive medicine, depending on which kind,
Hmm.
different kinds, and there are many side effects of anticonceptives, especially the injections. Then there is much to do about it now, and you of course you can repair it, but you need to know how.
Hmm.
And the other thing, I find very scary is that, and that is what I wrote, is that the increase of, for example, I know the numbers of UK by head. For example, in UK, 8.7 million people are on antidepressive medicine, and 12% rising during the pandemic. And it's twice as much in women, and
Hmm.
mostly it starts at young age.
And it was
Well,
also
there
very
are,
easy. It was also very easy here anyway to
yeah,
get prescriptions via Zoom. You
yeah.
know that, and of course, people were depressed. They were locked down. So I can see why that would be the case. There was very little supervision and a lot of prescribing that happened. But go on.
Yes, but you can also, depression you can reverse with nutrition and lifestyle. Many people know that, or many people also know that.
Hmm.
But and some they are so scared that they think this medicine will help. But what I also wanted to add is that with um, if women get pregnant, they are now advised to take during the pandemic 4 vaccines during
Right.
pregnancy.
Right. And it was completely untested.
And I
Um,
find it scary. I
hmm.
find it, um, I don't think it's ethical if it's not discussed with a woman what could be the side effects.
Hmm. Hmm.
We know that women react stronger with their immune system to vaccines. So
And
if they,
that from this is
they
pre-pandemic.
yeah,
Pre-pandemic, that was established by other things pre-pandemic, not
yeah,
just the
that
COVID
was no,
vaccine, right?
yeah. But
Okay.
now they mix it's diphtheria, tetanus, and pertussis.
Mhm.
They use flu vaccine. They use RSV vaccine, and they used COVID vaccine. They were never tested together, all four.
Mhm.
And they And if people were on medicine, it was never a discussion. So if they already used antidepressive medicine, which are known to interact with the COVID vaccine, it was never discussed about side effects. And if you know that the immune system is following a time clock during the pregnancy and is also important for the birthing moment. So that is exactly, it's the time schedule is so exactly that they know when it's time to give birth. So they are intervening in this system, and organs are formed, and whatever the brains are formed, the lung surfactants is formed, and this is all influenced by all these interventions which are from outside and which are not natural, and no one is talking about it. It's now, it was in the FDA, a discussion on using SSRI during pregnancy. And it was discussed that it might be better to taper off before you want to get pregnant. I think it's a very good idea, but I think it's even better before prescribing, you have to discuss with the patient what they are eating and what their lifestyle is, and how they can improve their lifestyle and their nutrition to get balanced. And maybe it can be, for a certain while, it can be helpful, but as soon as possible, it should be tapered off. If it are young women who didn't decide yet what they want to be pregnant, yes, no. And now we have, so what is for me intriguing is that the women who get most cancers now, or the age group is 25 to 44.
Which is reproductive age women.
And the people who have the most disabilities now are people between 25 and 44.
So what do you make of that?
Yeah, I think it's also in the numbers of the Netherlands, it's mostly women. So the number of people who are coming into disabilities are more women. The number of women is increasing. And if you look to the numbers of the Netherlands, which are in my latest paper, what you see is that the excess death in the Netherlands is mostly women. And the excess death of men, which was in 2020 and 2021, is declining. Excess female death is increasing.
Post-pandemic, it didn't go back down.
And if you look to the disabilities numbers, which are the stage before, we know that all people who have many chronic illnesses are more prone to early death. So if you are in a disability, there's more risk also for earlier death. And that is, it makes me very scary, because if this continues, it could be that the economic stability is really gone, because if there are not enough women to work in healthcare, there is no healthcare system, there are more people sick. And also there are no companies who can, there are companies who are also dependent on people. So who's getting the economy running? So it makes me very scary. And also, so I think it's an emergency, and there is no special funding for female health until now. It's always part of the bigger thing. Now it's becoming so emergency, especially also because the birth rate is declining very fast in every country. So there was a Czech study who found in 2001 it was 1.5 per 100 per thousand of was the mean birth rate per children per woman, and then 2 years later it's 1.45. So that is quite a big decrease. And you see that everywhere, also in the Netherlands, breastfeeding is going down. All these kind of things. So it's showing, these data are readings showing an emergency. And if there are no women in healthcare, there is no healthcare system. 80% is women.
So you're in the pregnancy thing, I wanted to go back to this because this is one of the things I found very interesting about the way you talked about the immune system during pregnancy as it being a clock. We know that people who took COVID vaccines during pregnancy, many studies show that there was an increase in miscarriage depending on the time of the intervention and also possible relationship. And again, I don't have the studies at my disposal, so correct me if I'm wrong, but premature birth.
Yes.
And we know there was a dysregulation of menstrual cycles. But once a woman is pregnant, you talked about the immune system as a clock during that pregnancy. Could you give an overview of that so people can start to look at it this way? Because it makes your view about interventions during pregnancy um, clearer.
I'm not prepared to give a detailed
No,
lecture about it.
just a summary.
I thought it is in 3 stages.
Hmm.
So the first 3 months, the second 3 months, from 4 to 6, and from 6 to 9. And we also know that there is at a certain point, it's if you are over the 20 weeks, it's not so dangerous anymore because before 20 weeks, there's more risk for stillbirth, for miscarriage.
Hmm.
And what I wanted, I think I can add something which is very important is that most people don't understand that the child which is growing into the woman body
Hmm.
is the nutrition of the woman.
Mm,
And they are competing with each other.
right.
So if you inject a COVID vaccine with lipid nanoparticles, which are forming biocorona, which are biocoronum. So they catch the lipid nanoparticles, catch vitamins and minerals in the body.
Oh.
So what they do is it's attracting the vitamins and minerals, which are also needed for the woman and the baby. So these are things which are very dangerous. And if you also know, and I think it was Sabine Hassan, the medical
Hmm.
doctor in America, who has shown that the bifidobacteria has been depleted after COVID vaccination. Those bacteria are very important for the immune system and the balance between the good bacteria, bifidobacteria are the good bacteria,
Right.
and the opportunistic pathogenic bacteria, which I was talking about earlier. So that's are the pneumococci, meningococci,
Hmm.
haemophilus. And if this balance is disrupted, you get all kind of diseases. But what is most important that the time of birthing is started with an inflammation. So if you uh, start to intervene during that process and you give vaccinations, you start an inflammation. And they have given 4 together
Hmm.
in a short time. So what is going on in this woman's body? But it's not only affecting the babies, and you can now see that there was even in the mainstream media that there was an emergency because there are many babies dying before the age of 1 year. It's in Mississippi. And Ethical Septic, which is a consultant and who's doing a lot of calculations like finance technologies,
Hmm.
earlier they stopped with it, which I find very pity because I used quite some data from them.
Hmm.
You see, he was sounding the alarm earlier, and I've
Yes.
also written a paper of it 1 year earlier with
Hmm.
data from finance technologies from Edward Dowd,
Hmm.
also known at Brownstone.
Right.
And what you now see is that the more babies dying. And what I think what is needed most is that we start to look what's happening to the woman from whom the babies have died,
Hmm.
happening to them. Because it can be that their immune system is also out of balance. So I think the most ethical thing to do is to help those women who have seen their baby die within 1 year,
Hmm.
to help them to recover their immune system. And this is really why what I'm calling out. There is really an emergency for females.
Mhm.
So if the next generation is now dying after 9 months pregnancy and within 1 year of birth, you have a big problem.
And you've also talked about an increase in suicide postpartum, and
Yeah,
well, and there's so many things here. It's hard to tease it out, but it's fascinating and it's very alarming. You also mentioned maternal deaths
yeah,
being on the rise, partly due to cardiovascular issues, and which you say, can't be simply traced to age of, maternal age, which even like you do age out of being able to have a baby. So it's not like even at the highest maternal age, you're not really in normal circumstances at high risk for cardiovascular events, or historically we have not been. And then also suicide. So I just wanted to make a note of that that's also very alarming, and that's happening in developed countries.
yeah. That's true. And they call in UK they call it death of despair,
Mm,
which means that it's mostly by they say it's mostly by alcohol or drugs,
mhm,
and but it's also mostly the woman in poverty.
mm, right.
So I'm mixing everything. So it's in 20% of the most deprived areas. We know that um, the women in poverty mostly work also the lowest salaries, as at least in the Netherlands, are in the healthcare sector, especially in nursing homes.
Mhm,
So in hospitals, nurses earn quite a lot more than in nursing homes. And that are mostly the persons who are at the age of a minimal of living wages.
mhm,
I think the living wages in most countries have been going down because the prices of the food has been
right,
increasing quite a lot.
right.
So
The
these women
prices for
can't,
everything, yeah.
uh, next to the stress they have to work in, they can't buy their own foods. And what I've also written, and that was in my first paper of females, those women work during the day in a nursing home, and after their work, they have to go to the food bank to get food.
Mm,
And I think this is not a world we could accept.
mhm,
I
and
think it's not ethical, it's not moral, it's really out of the road.
Yeah, I agree with you completely. Um, it seems very, dark and depressing,
Yeah, it's very
and
dark.
because it's not a single thing. It's not, "Well, if we fix this, we can move it along toward, a healthier life for our society and for women." Given all and I don't even we wouldn't have time, of course, during this, talk to tease out every single issue, but given what you've seen, could you talk about maybe ways in which we can start healing this problem? Maybe it's in certain populations or in different countries. What needs to happen um, to start to start looking at this and finding solutions? What
No,
needs to happen?
thank you for this question because what I see is look, before the pandemic, 2019, the WHO had a paper. They said, led by men, delivered by women, healthcare should change. And they said the woman should earn enough money and also have equal salaries to men at the same level.
Mhm,
If I look in the Netherlands, it's the politics um, who are not allowing this to happen. It are even the CEOs of healthcare organizations who are not um, helping to let this happen, and it's also not the insurance companies. And I think the insurance companies have a responsibility.
mhm,
They are paid. They are paid by many insurance people who are insured,
mhm,
but these people can't get the care they need because there are no healthcare workers anymore,
mhm,
and the healthcare workers have been underpaid. So not that everyone is working in healthcare. I know there are also
Mhm.
retail, and there's also education. But I would like to start with the first thing, which could be very easy. The insurance companies have a very big problem at the moment, but because they got less insured people, but the disabilities are increasing very fast. So they there was even Centene Medicaid in US. They had a very big problem with their stocks
Mhm.
because they are, and also with their um, forecasts. So they were not able for their stakeholders to take them with them in their forecasts because their forecasts were way off. So the only way they could solve these problems is getting funding together with, for example, the NIH with Dr. Jay Bhattacharya
Mm.
to get special funding for female health and start rebuilding the health of women and starting with the healthcare sector.
Mhm.
Because if the healthcare sector is running again, and also these healthcare workers start to know how they can work with nutrition and lifestyle, it's going to work and it's going to help the whole population.
Mhm.
And at the same time, I think the politics have a responsibility to make the budgets in this way that every single woman who's living independently can have a living wage, which means that they have enough money to pay for nutritious foods and
Mhm.
lifestyle and also their energy contracts.
Tell me, what do you mean energy contracts? What do you mean by that?
I mean, heating their house
Okay.
during the
All
winter
right.
or and
Okay.
cooking and whatever and reading in the evening, because in poverty, this is where people have to deal with.
Mhm.
And if you hear that in, for example, in UK, but also here in the Netherlands, the number of people who are in poverty is increasing quite a lot.
Yes. Yes.
And also, if you go to the immune system, they don't get vitamin D
Right.
in the winters. And it are these people who are coming in the hospitals with acute respiratory distress syndrome. So what are we doing? We are making a vicious circle, which is now going down the hill
Mhm.
very fast. And if we don't change this, we are going to see a very hard winter this time.
Mhm.
So it's for me, looking at it's now August.
Mhm.
So for here in the Netherlands, it's only 2-3 months before it starts.
Mhm.
So I would like to have, and it's in my latest paper. So I would like to have special programs to boost the immune system of women.
Mhm.
So for research, that would be for the NIH,
Mhm.
but I would like to start. It's not waiting 5 years before there is peer-reviewed uh,
Right. Right.
research because it's an emergency.
Well, and I think if you just pull the camera back a little and start observing what you can see it in real life. It's not that you need
Yes,
to have exhaustive statistical analysis. And even if you just take like Ed Dowd's work or work that's similar and look at the number of disability claims and how they have skyrocketed,
really
you know,
sky.
and that'll just, I mean, just from an economic standpoint alone, not even just the human suffering.
Yes.
It's so clearly something's very wrong. Would you see those programs originating from, and who would administer them in terms of
I think,
education and delivery? Or,
yes, what I think is the insurance companies have the responsibility to do something back to the females because they haven't paid them for years in the healthcare sector.
Mhm.
So I think that is their responsibility.
That's an interesting way to. I've never thought about them as being
Yeah, it's a
a
moral thing.
player. Yeah, it would be the moral thing, and it seems to me it would be the, economically advantageous thing to do for those corporations because after an investment, their returns would just be better.
Yes, the return
Delivery
of
would be
investments
better.
are very, very big. So I
Yes.
also don't understand that uh, there are no investors talking about this. So
Mhm.
I'm very surprised because in this is the biggest return on investments. Such programs would be the best to do now. And what I also would like to do is addressing the over medicalization, misdiagnosis. So I want to raise awareness of this big problem, so that medical doctors start to understand, but also women get more voice in the talking to a medical doctor. That is what I do. I guide them how to talk to a medical doctor, and it's their body, so they can decide themselves. A medical doctor can never pressure you to take a medicine or a vaccine. I would also like to have approved vaccines or medicine without clinical placebo controlled clinical trials, that they have a warning on the box that there is no
Real placebo.
Never have been such thing.
Yes.
And I also would like to add, which is also in my first article, is some medicine, it took quite a long time, but they knew it was very damaging for women to get off the market. I now want that when it's known, and we knew it from the COVID vaccines. Naomi Wolf has been
very
speaking
early
about it from July 2021. I've been also in the same time I was at LARAP with the side effects, studying the side effects of vaccine. I've been discussing there and about menstruation and fertility, and I said, can we please pause and see what the side effects are? They didn't do it. I want that this will be taken seriously. So with the new NIH and the new CDC, I hope it will help, and they will understand that it's not possible to continue like this. And then we always already discussed this, gender equal payment and also acknowledgement. So it means that women are really appreciated as being equal in society. And then the latest, which I think is very important, and also what's happening now in the world, and especially also in the Netherlands, is that there will be zero tolerance for mental and physical abuse in the workplace, because in the workplace, in the healthcare sector, is very common, and that is one of the things for suicide of healthcare workers. And I find it very scary. But it's not only from the patients or the partners of the patients, and this is increasing because the quality of care is decreasing. Also internally of colleagues between each other.
Because everyone is under.
I find it very scary. And it's also in society. So I would like to have zero tolerance for that, so that everyone is not accepting it anymore. That we just bully someone, which is not necessary. You can just have a dialogue. If you look in the pandemic and you call someone of being how was it called? I forgot the name, but in Dutch it's wappie, or it's being anti-vaxxer.
Oh, right. Or like,
these kind of things. Everyone who had a different view from a scientific kind of perspective was labeled. If you label someone, there is no open dialogue anymore. So I was very happy with the new framework from Dr. Jay Bhattacharya, that he said he wouldn't allow it in his institute anymore. That it's not possible. He wants an open society, free and creative. And if you bully someone, there is no innovation possible.
Right.
As a CEO of a healthcare organization, which I've been, if I would allow that, then I know I would never get the creative ideas I need to get out of a crisis,
right?
Financial crisis or whatever, because people are scared to say something.
Exactly, and that's exactly what happened here, well, and all around the world, because of censorship and because people
Yes.
were so vicious, toward others that didn't share their opinion. All dialogue, all like, discourse, it was just shut down, and things that could have been discovered to save lives and to really help people and to unite people against whatever it was we needed to fight, whether it was the virus or the lockdown, whatever, depending on your point of view, all of that was erased just by pitting people against each other.
Yes.
So I think, and part of the first step in this seems to me just to be always raising awareness about it and to
Yes.
get, the people who might not study these areas to start looking at it a different way. I mean, I know for me, I'm aware of a lot of the collateral damage of the pandemic because I've been paying attention in a way that many people perhaps aren't, or they don't want to talk about it. They don't want to look at it because, oh, that's over. Let's move on kind of thing, which I find incredibly dangerous, right? Because they're not paying attention. But even for me, like reading your articles, talking with you today, it makes me take a moment and look at really the crisis for young women, and that's going to translate particularly in fertility, to marriage rates, to families starting, which to me that is just as important as the healthcare. Like it's all, excuse me, of a piece. Um, that it's putting a wrecking ball through our society and through our mental and physical well-being. So the work you're doing to me is just so important, and I think we just have to keep amplifying that and keep talking about it and pushing for policy change everywhere.
Thank you. And that is also my aim because um, I think it's the time. It has been for 100 years. It has been our longer. It
Yeah.
has been the opposite. Um, and now it's so going down the drain that you can't. It's a crisis.
Yeah, it is a crisis.
So I'm looking at it like I've been a change manager for 15 years. To the problems during the pandemic, I've always been looking from my immunology called background, but
Hmm.
also as a perspective of a crisis manager.
Hmm.
And this combination, that's why I was so interested in the analysis of finance technologies. When I first saw them appearing at X, I thought, oh, I need,
Hmm.
because we can't do what they do. And from the immunological part, I can explain what's happened. And what now is needed is the turnaround for equality
Hmm.
and respect for both genders. And I hope we can turn it before it's too late.
Hmm.
Because that I didn't say yet, if the mother isn't healthy, the child wouldn't be healthy.
Right.
So we didn't discuss that, but what ethical septic saw was there was an increase in certain infant death. There's an increase in genetic malformations, but this is also known in in areas of poverty. So
Hmm.
it's are all similar thing, and these have to do with epigenomics. So it has to do, and as, I noticed this a bit of it, the competition of the food between the mother and the child. So if the mother isn't really healthy in nutrition and lifestyle,
Hmm.
the child will also, it will be very difficult to have a very healthy child.
Hmm.
And that is what you see in developing countries, that most children die before the age of 5 years.
Hmm.
So you are right. Next to the healthcare workers, we have to start with all these young women who are now at the age of 18,
Hmm.
20, to educate them how important it is to take care of themselves. And that is the first lead.
Hmm.
And it's not important to how you view on a picture on social media or whatever,
Right.
but it's more important, how can I become healthy and strong enough to bear children if I
Mhm.
want.
to bear healthy children and
Yes.
to survive childbirth and postpartum, which is a terrific stress on the body. I think, the things that we probably used to observe exclusively in countries with great poverty, I'm just saying it's probably starting to increase in developed nations because the health
Yes.
of people, like in the US, I mean, people are just so unhealthy, just in terms of being overweight, poorly nourished, vaping, drinking, all of the things you talked about, the toxicants. And then now we have like so many suggested and mandated interventions over the past 5 years during pregnancy, before pregnancy. Even like the college situation here, they were wholesale mandating at over 1,000 colleges that
I know.
students get the COVID shots, even as they knew that there were disruptions in the menstrual cycle, and there were studies to show that there were, albeit temporary, decreases in sperm counts. And yet there was nobody who said, "Wait a minute, we might be tinkering with fertility or with maternal health, in the future." So it's very alarming that these things are disregarded completely by
Yes.
the people making policy, and it's probably multifactorial, and I think, and a lot of it, of course, is profit motive, but much of it might be that people just need to reframe the way they view these things now, because our society has changed so much. Back in the day, people viewed it very differently, and then women went into the workforce, and we were taught the career was more important, all of these things. And that I think that people just now view pregnancy and childbearing as something that's incidental. That's like something, it's not something to really think of as a complicated, sacred system that we need to support and nourish and not mess with.
Yes, it's especially also necessary to have a care for that because of the increasing cancer in this age group. Hello?
I lost my internet, I'm sorry. Yeah, have happened, but I'll edit that part out.
Yes.
Right.
What I was saying is that we need also special attention to this young women who have been giving birth to a child because we see the raising of cancers in this group, in this age group.
And how long have those
And
been
if
going on?
it's a collapsing of the immune system. So most people don't understand that in the end, it's all the same. It's all this collapsing immune system
Mhm,
because the immune system is everywhere. But if your gut is not healthy, the rest of your body can't be healthy as
mhm,
well. And if you are depleted in nutrition during childbirth and giving birth and giving breastfeeding, it continues.
mhm,
How many women are not going back to work because they are overtired?
mhm,
They are fatigued. They can't concentrate, or they can't walk normally because, or they can't take up their child if it's crying because it's too heavy.
mhm,
This is what's happening.
mhm,
And if the immune system is going down, the risk for cancer is increasing.
mhm. And then who's gonna take care of those children? How is that, if
Yes,
somebody
and it's
is
both sides. So
disabled or
therefore, I think it's so what Kennedy is doing is focusing now on the children, but he's
Mhm,
forgetting this young woman who was giving birth to these
right,
children.
right, right.
And he's also forgetting the healthcare sector as a special sector because if there are no women
Caretakers, yeah.
uh, delivering care, they can't take care of all these children and females who are out of balance. And of course, there are also men, and men need also good care.
Of course.
There's no for me, there's really no difference.
Mhm,
Only there has never been a special attention for women who have more risk at
mhm,
certain times
mhm,
in their life. And this should serve. And they should be paid like men
mhm,
for the work they do.
sure. And
And if that is equalized, we get a really equal play.
Mhm.
And then we get a healthy society and the economy will flourish.
And people will, engage with each other and, everything would be better, for
Everything
certain.
would be better.
Yeah.
But uh, the most important thing is now is that the healthcare sector is driven with money, and it's the fastest uh, rising money is the easiest um, sector to raise money by investors. So therefore, there are many investors interested in this
Sure.
because it's governmental money which is coming to the organization. And what they do is they start to decrease the quality of care and taking more money out of the
Right.
system.
That's very clearly happening here.
And that is what's happening. And therefore, the healthcare sector is collapsing. Therefore, I say the insurance company will become very, very rich.
Mhm.
Also in US, also in UK, also in the Netherlands. They have the responsibility to repair this.
Mhm.
They've taken too much money out of the system.
Well,
It doesn't
eventually,
work.
and
Hmm?
it won't be sustainable for them long
No.
term
And they
either.
are going to collapse themselves.
Right,
So
right,
what are they going to do?
right.
That
But
is my main message. So the what I wanted to say is the healthcare system is driving on women with the lowest salaries. So there's much money taken off,
Mhm,
and it are the women they are earning most on because they are um, taking care of their body more. So they are more often going to a medical doctor, and
mhm,
they need to pay a certain amount themselves.
mhm.
So also the healthcare system is growing on the woman body. So it doesn't fit.
Right.
It is abuse. I call it abuse.
Mhm. Well, and it's just a vicious cycle, that's,
No, it's
going down and down.
two times abuse.
Yeah.
Over medicalization and over diagnosis
Mhm,
and low salaries for
mhm,
working in the sector.
mhm.
It's all women.
Yes. Well, I think the first step, as we talked about, is raising awareness of this, getting people to think about it differently. And what I hope will happen is people, especially in the US, will take full advantage of the shift in our healthcare at the federal level and start advocating for these things specifically. Um,
Yes.
to that end, in the show notes, I'm going to point to all of your work, also Kabbalah, which is
Thank you.
good care feels better. And do you take clients, individually from the US as well with that
And
to
it's very difficult for me.
um, to do that in the US?
Um, so
But you
I
do
have
it.
to, and I had so people who are interested in my work can contact me,
Mhm,
and then I can see what I can do.
mhm,
But also, my workload in the Netherlands is increasing because there
mhm,
are so many people ill
mhm,
in disabilities. And what my specialty is to getting people who are long time in disabilities to get them back in their own work.
mhm,
And that is really, if I'm able to guide the people to get back in their own work, which I also loved when I was by myself misdiagnosis. I
mhm.
was not allowed to go back as a CEO. So that is also my personal drive to get people back in their own work because it's best. It's best for their health.
Right.
Why? And even I think it are even better employees than the people who haven't gone off the road.
Mhm.
I went off the road.
Uh-huh.
I've been off the road on difficult ground. But if you come back, you know what it is to be outside of the
Mm,
society, and people look different to you. You have a totally different attitude.
mhm,
And this is really making it strong because people have come their own leader. They are not they are interdependent in an organization but not dependent anymore. And if you are interdependent, you are able uh, to speak out.
mhm.
You are not afraid to speak out and to say what you have to say and what you see. And then you get really creative and innovative organizations. And that
And
is why I'm so interested to get the people who are off the road back.
mhm, because you can become a contributor again, you're not isolated,
Yes.
and the positives just snowball up from there, if that's the use of the
Yes.
metaphor.
Also to the other colleagues, because the employer who's paying me for guiding those persons is an employer everyone wants to work, because this employer is taking care of me when I'm
Right,
becoming ill
right,
or when I'm going down the road,
right.
off the road. It can happen to anyone. It
Oh,
can
sure.
really happen to anyone.
And it can happen very quickly in
Yes, it
addition
goes
to the
very quickly.
insidious disguise. Yes, yes. Um, well, I think the work that you do is incredibly important, and it's just reading your work and talking to you today has raised my awareness and the way I think about these things a great deal. And I'm hoping that everyone who listens to this, and if you want to distribute it as well, will start to think a little bit different, because that's the first step to getting people to help, to advocate for these policies, but also to take command of their own situation and make the changes necessary in their own lives. So I thank you so much for talking to me. And before we break, where can people find you? Are you on X or your website? And I'll put it all in the show notes.
So thank you for this great compliments. It was a pleasure to give an interview in English, and I hope many people will listen to it.
Hmm.
They can contact me via goodcarefeelsbetter.com. Good. It's also on the website of
Hmm.
Brownstone, where I'm an author. And so there is a page on my website, contact at goodcarefeelsbetter.com. And I'm on X, Carla Peters 3,
Okay.
3, number 3. So I will send you, that people can find me easily, I think.
Okay, great. And I'll link to your author page on Brownstone so people can read your articles, which are terrific and packed with information, lots of
Thank
facts.
you.
So thank you again, Dr. Peters. It really was delightful to talk to you, even via Zoom or face to face. So it's really a privilege. Thank you so much.
Thank you very much for interviewing me.
Oh, my pleasure. Okay, bye bye.
Bye.